Good afternoon from Roanoke, Virginia, where it's well into the 90s today. My name is Chuck Paget, and I have the pleasure of addressing the first virtual SAGES conference. I have nothing to disclose. A little bit more about me, in that I've been a surgeon for a while, and I've been in different roles as a surgeon, and have been an academic surgeon for the last bit. And where most of my focus has been on resident education, mentoring, where I got really interested in wellness, and especially in trying to provide the background that will allow people to practice for multiple decades. So we'll go back here. I'd also like to introduce an individual that many of you may know already, Dr. Sotil, a psychologist who is specialized in understanding physicians, why they do and process what they process in the way. If you've ever heard him speak, you'll find out that quickly Dr. Sotil knows more about being a surgeon than you know about being a surgeon. I'd like to credit him for a lot of the work that's gone before this, and really having worked with myself, with my resident group, thank him for all the things he's done. And a lot of these things will show through if you've heard him speak before. If you do get a chance to see him speak, please do. I'd also like to say how this talk has changed between when I wrote this in January or February this year, and then COVID, and some things that have happened within our residency. Tragically, one of the members of our residency lost a 5-month-old child unexpectedly through a SIDS death. It was particularly horrific, and how it all played out. And this was made much worse by the fact that we were all apart. We couldn't really spend time together, and how vulnerable we were apart and together was made clear for this. And this is especially poignant to me based on events just in the last several months. So the goal is to talk and to identify some of these problems, and the ones outside, the ones that have been already mentioned in the two prior speakers, acknowledge these and the stressors that go along with them, and set up the discussion for later speakers to tell us how we somehow rise above. So from an academic standpoint, the demand control theory is a relatively old one that seems to work very well for explaining why surgeons find difficulty in their everyday lives. And it posits that there are high control and low control jobs, and high demand and low demand jobs. And where we function very well as surgeons is in the high control, high demand, and we do very well with this. But our problems become when there's a high demand upon us, but very low control, and this is where the problem is. Looking at this, most of you can see yourself in this demand. I don't even have to enumerate those. Now, more and more of us find that we have less and less control, whether it's from insurance companies, regulations, hospital bureaucracy. All of this feels like it is taking control over our ability to do what we do best. And it creates the dissonance that creates the psychological strain that makes our lives stressful and at times just unlivable because of this. If I'm going to do this job, I really need to be able to have the control to do it right. Also look at us, and maybe the first person to look at when you're having these difficulties, look in the mirror. Realize that most of us have control needs, are relatively obsessive about what we value, and oftentimes we bring a perception of low control to the process, and maybe we undervalue the control we have. We have difficulty saying no, whether it be to another case, another patient, another responsibility, another academic opportunity. And we've been taught for years to be the one who steps forward, steps into it, to be that person that is a leader and generates the results that we want. And finally, I talked about our need for affirmation, which is no small part of who we are. We want to be valued for what we bring and how hard we work. But when we don't get this, it doesn't create this daily affirmations that allow us to go forward. And we really have to think about that money has very little to do with this. If you're not valued for what you're doing, it doesn't matter what you're paid. I'd put up that these are the group of the people that really create or in situations that create stress for us. The operating room is fairly obvious. Most of the time, that's a very low stress environment for many of us, but there are times that it certainly becomes exceedingly high stress. It also leads to the last item on that, the complications that we have to live with. Our significant other, our family are our strength many times, but our inability to provide for them, as the individual I described, or our inability to support those people that we consider our family is especially stressful on us when we thought we were otherwise doing well. Our personal health often gets put in the back seat, and we can talk about all the demands that go with being a surgeon. So I'll talk about the operating room first. It's really everything that's good and bad about our lives. Are the others in the room supporting us? Are they sufficient to support it? Do I have a scrub tech or a circulating nurse or an anesthesiologist who really supporting me in this very complex operation? If I have mistakes, am I going to be supported by the other surgeons around me, or are they going to take this opportunity to blame me and tear me down? And more around that, is the organization, whether it's my partners in the practice, the hospital, the whole university system, how much are they there to help me as opposed to hinder me, or at least how do I perceive that? Our significant others, our family, are often our support. However, we need to be part of this relationship, and oftentimes we found ourselves being drawn away and don't do our own part. Relationships are hard, and they can also make, as much as they can lift us up, they can also drag us down. And how much are we guilty of not maintaining that relationship? Our personal health, all of us would like to say we're eating well and exercising, but is that really true? We're often too busy to seek our own health care, especially med, and it takes time. And health issues are patients, not for us. And finally, why we became surgeons. We like being busy, but we sometimes have trouble drawing that line. And our reaction often to stress or is to immerse ourselves in work. Hardly a habit that's always good for us. And we don't seek the support from others. In fact, we really don't think we need support, which is really when most of us realize that a lot. Our complications are there to remind us that we're imperfect, but many of us cannot leave it at the door. Complications have been some of the hardest things I've had to deal with. It keeps you from sleeping at night. Having to see the patient over and over that you feel you've failed, all those are difficult burdens to bear. And we're not taught how to process this failure, either as residents or certainly not as attending surgeons. It just emphasizes, once again, our lack of control. So a few final thoughts. I've set up a lot of difficult things, and I hope the later speakers will be able to address these. These problems are not new to them. You know about them, but have you addressed them? And have you, in your own way, thought about them? I would ask about this lack of control. Is that a perception, or is that truly the reality? And how much have you done to fix this? You really can address many of these things. Remember, what made you good at being a surgeon is also what's putting you at risk. Remember, your training really didn't tell you how to deal with this. I'm hopefully, and we're hopefully as a education group moving forward in terms of trying to address this, but this is going to be a long-term fix. And I would also say that our institutions certainly don't understand us. As physicians, they barely understand us. And I think the surgeons are an outlier even within that group. And that's part of my, what I've got from Dr. Sutil, is that we need to end up being the ones that support one another because we understand each other the best and we see what the issues that we are dealing with are. So I thank you for the opportunity to speak to you, a few of my acknowledgments, and also a view from our hospital and medical center. Thank you very much.